Welcome. Today we're going to speak about tobacco and alcohol, two critical risk factors for health. By the time you finish this session, you should be able to speak comfortably about the importance of tobacco and alcohol to the burden of disease, the health, economic, and social consequences of tobacco consumption and excess alcohol use, and selected measures for addressing tobacco and alcohol use. Let's speak first about tobacco. Tobacco is an especially important risk factor for cardiovascular disease, cancer, and diabetes, and therefore it bears specific discussion of its own. As you can see in this graphic, tobacco consumption, smoking, was the second leading risk factor globally in low and middle income countries and in high income countries that related to deaths in 2013. In fact, when we look at the same for DALYs, we'll see that smoking is again an especially important risk factor. It's the second leading risk factor for DALYs globally. It's the fourth leading risk factor for DALYs in low and middle income countries, and the third leading risk factor for DALYs in high-income countries. It's estimated that about 5 million deaths annually are associated with the use of tobacco, and about half of those deaths are actually in low-income countries. It's also estimated that 1 in 5 males over 30 and 1 in 20 females over 30 who die worldwide actually die of tobacco-related deaths. Ultimately, 1/2 to 2/3 of those who smoke will die of causes related to tobacco consumption. In addition, half of all tobacco-related deaths occur among people who are 35 to 69 years of age. The most common tobacco-related deaths, as most of you will know, are from cardiovascular disease, diseases of the respiratory system such as emphysema, and from cancers. Tobacco use can also increase, and many of you don't know this, tobacco use can also increase the risk of getting tuberculosis or dying from it, as well as substantially increase the risk of becoming diabetic. Most tobacco is used through either smoking cigarettes or bidis, which are hand-rolled cigarettes used largely in South Asia. It's estimated that about 1.5 billion people worldwide smoke tobacco. And of countries that participated in a recent review by the World Health Organization on tobacco prevalence, Russia had the highest rate of smoking at about 39% of all adults. Indonesia was second at about 35%, and Nigeria, among those countries that participated in this survey, was the lowest at just below 4%. In all regions of the world, men smoke more than women do. This is most pronounced in the low-income countries, in which relatively small share of women smoke. And here we see, in fact, a graphic that looks at smoking prevalence by sex, with females in orange and males in blue, for World Bank regions, high-income countries, and globally for 2011. We see, as I mentioned, that consistently females smoke at lower rates than men do. We also see how that ranges from very low amounts to about 22 in Europe and Central Asia, and about the same in the high-income countries. We also see that among men, it varies from as low as 26% in Latin America and the Caribbean to as high as almost half of all men in East Asia and the Pacific. When we think about individual countries, the highest rate of smoking prevalence among males is actually 67. I'm going to repeat, 67%. 2/3 of all the men in Indonesia smoke, as Shaylin assents to, having lived there, and despite her deep affection for the country, she recognizes this is an extraordinary share of the adult male population which smokes, and a lot of youngsters smoke too. Russia had the second highest rate of prevalence at just over 60%. Of the countries surveyed, the lowest rates of smoking among women were less than half of 1% in Uruguay and about half of 1% in Egypt. Now, the extent to which people take up smoking varies not only by sex, but also by socioeconomic status and level of educational attainment, as I think almost everyone understands. The higher the socioeconomic status and the higher the level of educational attainment, the less likely one is to smoke. The lower the educational attainment and the lower the socioeconomic status, the more likely one is to smoke. Most people, as you also know, start as teens. But it's especially important if we're going to bend the curve and reduce the number of people who smoke, that we both prevent people from starting to smoke, but also try to ensure that some of the smokers who smoke today, in fact, as many as possible, stop smoking. This will not be easy. Tobacco is physically addictive, and once one starts to smoke, as you also know, it's not easy to stop. In some countries such as Canada, Poland, Thailand, the United Kingdom, and the United States, and Uruguay, the use of tobacco has been declining, often linked to some very successful policy efforts and regulation on behalf of these countries. However, the rates of smoking continue to grow in a number of settings, especially in low and middle income countries among men, and actually in almost all regions, the share of women who are smoking tobacco is actually going up. And I think, as you understand, what happens is when countries are relatively lower income, they don't smoke. The prevalence of smoking is not usually very high. As they become more middle income and as gender roles become more equal, the rates of smoking grow first for men and then for women. And then as countries become higher income, but couple their being higher income with measures to address tobacco consumption, the rates of tobacco consumption usually begin to fall, both among men and among women. What's quite clear, though, is unless steps are taken to stop the spread of tobacco use, we're likely to see continued growth in cardiovascular disease and cancers related to smoking. And many of these are avoidable, and the overwhelming share of these are actually going to occur in today's low and middle income countries. Studies on the cost of smoking have largely been done in high income countries. And there's not that much data on the cost of smoking in low and middle income countries. The costs of the studies that have been done have suggested that the cost to the economy of tobacco consumption varies from about 0.1% to just over 1% of gross domestic product. Now, it's estimated that 70 million people died of smoking-related causes between 1950 and 2000, and that if present trends continue in tobacco use, an additional 150 million people will die of smoking-related causes between 2000 and 2025. And of course, the health, individual, societal, and economic costs of this will be great. And this highlights again the need to get present smokers to quit, as well as to stop people from taking up tobacco consumption in the first place. Now, the Framework Convention on Tobacco, which the global community agreed to in 2003, outlines measures that countries have agreed to undertake to reduce both the demand for and the supply of tobacco. And the World Health Organization has elaborated on these measures by outlining a program called Empower, which specifies particular measures that can be taken to reduce tobacco use. This includes setting up an ability to monitor tobacco use and to promote prevention policies, offering help to quit tobacco use, enforcing bans on tobacco advertising, promotion, and sponsorship, raising taxes on tobacco, warning, like through warning labels about the dangers of tobacco use, and preventing people from tobacco use through measures such as smoke-free zones.